let me tell you some very important points about the local anesthetics. Right, some very important points about the local anesthetics. Now, as we have seen, the fibers which are blocked first, remember this is a very important point. Small diameter fibers, remember this, the small diameter fibers or the small diameter axons, these are more susceptible, right, these are more susceptible to block than large diameter fibers, right, they are more sensitive or they are more susceptible for blockade than the large diameter fibers. Next, another important point is you take in between myelinated and non-myelinated fibers. Myelinated fibers, they are more sensitive for blockade than non-myelinated fibers, right, myelinated fibers, they are more sensitive for blockade compared to that of non-myelinated fibers, right, compared to that of non-myelinated fibers. Next, you take the sequence of blockade, right, if you take the sequence of blockade, remember type B fibers, they are blocked first, followed by that type C fibers, followed by that type A fibers. Okay, so type B followed by type C and then followed by type A fibers. Next, you take in the functional terms, right, you take in the functional terms. Remember, autonomic fibers, they are blocked first, followed by that the sensory fibers are blocked next, and the last one are the motor fibers which will be blocked. Again, within the sensory fibers, the sequence of blockage, right, again in the sensory fibers, the pain sensation is the one which is blocked first, followed by that the temperature sensation is lost, right, even within the temperature, right, the cold sensation that is lost before the hot sensation. Okay, so pain is lost first, followed by that the temperature, even within the temperature the cold is lost before the heat, and followed by that the touch sensation is lost, and followed by that the deep pressure is the sensation which is being lost, and followed by that the last sensation which is being lost is proprioception, right, proprioception. So this is the sequence of blockade in the sensory sensations, that is pain, temperature, touch, deep pressure, and as well as the proprioception. Next, now another important point what you should remember is you take all the local anesthetics, this is a very important point, all the local anesthetics, these are vasodilators. Alright, all the local anesthetics, these are vasodilators. The exception here is cocaine, right, except cocaine. So all the local anesthetics are vasodilators except cocaine. This cocaine, it will cause vasoconstriction. Right, this particular cocaine, it will cause vasoconstriction. So this particular cocaine, it acts as the sympathomimetic drug. That is the reason why it is vasoconstrictor. Now why it acts as sympathomimetic drug is, remember cocaine acts as the sympathomimetic due to inhibition of noradrenaline uptake. Right, what the cocaine will do, it will inhibit the noradrenaline reuptake, and that is the reason why it is acting as the vasoconstrictor. So remember, all the local anesthetics, they will decrease the blood pressure, whereas cocaine will increase the blood pressure of the individual. So remember this point, cocaine will increase the blood pressure of the individual. Alright, next. So that is the reason why, remember this very important point, cocaine should never be given by intravenous route, or it should never be given with adrenaline. Okay, so this cocaine should never be given intravenously, or it should never be given along with adrenaline. Because when you give this along with adrenaline as such, it will increase the blood pressure of the individual. When you give it along with cocaine, it will further precipitate increase in the blood pressure. Alright, next. Now another important point about the cocaine is that the cocaine is the only ester. This is another important multiple choice question. Cocaine is the only ester which is not metabolized by the pseudocholine esterases. Right? If you take the esters, they are metabolized by pseudocholine esterases. Right, they are metabolized by pseudocholine esterases enzyme. Cocaine is the drug which is not metabolized by pseudocholine esterase. Where it is metabolized? Remember, this cocaine, it is metabolized in the liver. Right, cocaine is metabolized in the liver. Alright, so this is about the cocaine. Remember these points. All the local anesthetics are vasodilators except cocaine. Cocaine, because of its sympathomimetic effect, it will cause vasoconstriction, and all the local anesthetics will decrease the blood pressure, whereas the cocaine will increase the blood pressure. So that is the reason why cocaine should never be given intravenously, or it should never be given along with adrenaline. And all the esters, they are metabolized by the pseudocholinesterase enzyme, whereas cocaine is the ester which is metabolized in the liver. Alright, next. We have another important drug which is called Procaine. Right, we have another important drug which is called Procaine. If you take this particular Procaine, remember Procaine is the local anesthetic of choice in case of malignant hyperthermia. So in case of malignant hyperthermia, this Procaine is a drug of choice. Right, this is another important multiple choice question regarding the Procaine. Next, we have another drug which is called as chlorprocaine. Right, we have another drug which is called chlorprocaine. Remember, the important multiple choice question about the chlorprocaine is the shortest acting local anesthetic. Right, remember this point. This is the shortest acting local anesthetic among all the local anesthetics. Right. And another important point about the chlorprocaine is this chlorprocaine, it is contraindicated. Right, this is contraindicated in spinal anesthesia. Okay, so this is contraindicated in spinal anesthesia. Why it is contraindicated in spinal anesthesia is because this chlorprocaine can cause paraplegia, that is paralysis of both the lower limbs. Now, why this chlorprocaine will cause paraplegia? Because this chlorprocaine, it is formed or it is synthesized along with a preservative which is called as sodium metabisulfite. Right, there is a preservative which is called as the sodium metabisulfite. Okay, so this particular preservative sodium metabisulfite, this is a neurotoxic substance. Okay, so this sodium metabisulfite, which is a preservative along with chlorprocaine, is a neurotoxic substance. So when you give chlorprocaine for spinal anesthesia, this chlorprocaine can cause paraplegia. So that is the reason why this particular chlorprocaine is contraindicated in spinal anesthesia. And another important multiple choice question is, it is the shortest acting local anesthetic drug. Next, now remember, all the local anesthetics, once they are absorbed into the systemic circulation, they can cause CNS toxicity. So remember, all these local anesthetics, if they are absorbed into the systemic circulation, they can cause the CNS toxicity. And now what will be the manifestation of the CNS toxicity? Remember, this particular CNS toxicity, this is manifested as initially they will have excitation, followed by the excitation they will have depression. Right, followed by the excitation they will have depression. So initial excitation, why there will be the initial excitation? Remember, this particular initial excitation by the local anesthetics is due to inhibition of inhibitory neuron, right? So initial excitation, this is due to inhibition of, right, due to inhibition of inhibitory neurons. Okay, so that is the reason why there will be initial excitation and followed by that there will be depression. All right, now you take this all the local anesthetics, because of initial excitation they will cause seizures, and followed by seizures the individual will land up in coma. Right, followed by seizures the individual will land up in coma. So this will happen at high doses. Right, this will happen at high doses. Remember, all the local anesthetics that will lead to seizures followed by coma at high doses. All right, so that is about the story of local anesthetics once they are entering into the systemic circulation. Next, let me talk about some other local anesthetics like Bupivacaine. Now if you take this particular Bupivacaine, remember Bupivacaine is the most potent local anesthetic drug. Right, Bupivacaine is the most potent local anesthetic drug. Not only most potent, it is also the long acting local anesthetic. Right, it is also not long acting, it is the longest acting local anesthetic drug. And the very important point is, it is the most toxic local anesthetic. Right, it is the most toxic local anesthetic drug. Whereas you take the other drug, that is chlorprocaine. That is chlorprocaine. Remember, this particular chlorprocaine is the shortest acting local anesthetic drug. All right, so Bupivacaine is the longest acting local anesthetic, whereas chlorprocaine is the shortest acting local anesthetic drug. Next, let me talk about some points on Lidocaine. Right, Lidocaine. If you take this particular Lidocaine, this is one of the most commonly used local anesthetic drug. Right, this is one of the most commonly used local anesthetic. And remember, this particular Lidocaine, the multiple choice question about the Lidocaine is, this is the drug of choice for ventricular tachycardia. All right, this Lidocaine, this is the drug of choice for ventricular tachycardia. Right, this will be an important multiple choice question. Next, the another important adverse effects with the Lidocaine. Right, that is a disadvantage with the Lidocaine. Lidocaine can precipitate malignant hyperthermia. Right, can precipitate malignant hyperthermia. All right, next, how it can precipitate malignant hyperthermia is, remember, it can precipitate malignant hyperthermia due to release of calcium. Right, due to release of calcium. Next, now coming to the dose of this particular Lidocaine. The dose of Lidocaine, it is limited to 7 mg per kg. Right, it is limited to 7 mg per kg. but always you should give this with adrenaline. So remember, dose is limited to 7 milligram per kg with adrenaline. But when you are giving this particular lidocaine without adrenaline, don't give this high dose of 7 milligram per kg. So without adrenaline, the dose is 4 milligram per kg, that is without adrenaline. So without adrenaline, the dose is 4 milligram per kg. With adrenaline, the dose is 7 milligram per kg. Is that clear? Next, let me discuss about some more local anesthetic drugs. Next, let me discuss about the other important local anesthetic, that is Bupivacaine. Right, that is Bupivacaine. Now remember, the important multiple choice question about the Bupivacaine is the best drug for regional block. Right, this is the best drug for regional block. Alright, this is considered as the best drug for the regional block. But the problem is, Bupivacaine is the only local anesthetic which is most cardiotoxic. Right, it is the only local anesthetic which is most cardiotoxic. Right, because of its cardiotoxic effect, remember this point, because of the cardiotoxic effect, it should not be used, right, it should not be used for Bayer's block. I'll tell you what is Bayer's block. Right, due to its cardiotoxic effect, it should not be used in Bayer's block. And you compare this Bupivacaine with Lidocaine. Remember, this particular Bupivacaine is more potent and long acting than Lidocaine. Long acting than Lidocaine. Right, remember this point. Alright, next. Now, what we were trying to do, in order to increase the duration of action of the Lidocaine, we were adding adrenaline. As such, Bupivacaine is a long acting drug. So, addition of adrenaline, right, addition of this particular adrenaline does not significantly increase the duration of action of this drug, right. So addition of adrenaline does not increase the duration of action of this particular drug. Next, now remember, Bupivacaine is the best drug for the regional block. So where do we use this? We are using this particular Bupivacaine for spinal anesthesia. Now remember, for spinal anesthesia, the solution which is prepared is, it is a 0.5% solution. Right, 0.5% solution is made hyperbaric with 8.25% dextrose in water. Alright, so the solution is 0.5% solution is made hyperbaric with 8.25% dextrose in water. Next, if you take the dosage of the Bupivacaine, remember the maximum dose of this particular Bupivacaine is around 2 milligram per kg. Right, the maximum dose of Bupivacaine is around 2 milligram per kg. Next, now I have said you this Bupivacaine is cardiotoxic drug. Now what is the cardiotoxicity caused by this particular Bupivacaine? Remember, Bupivacaine can cause ventricular tachycardia. Can cause ventricular tachycardia. Next, now you take the ECG findings when the individual is given Bupivacaine. The most common ECG changes in Bupivacaine toxicity are slow idioventricular rhythms, right? Slow idioventricular rhythm. Now, apart from this slow idioventricular rhythm, the other ECG changes is slow idioventricular rhythm with broad QRS complex, right? With broad QRS complex. All right. So this will be the ECG changes with the bupivacaine. So remember, bupivacaine is the best drug for the regional block, but the problem is it is most cardiotoxic. That is why it is avoided in Bayer's block. The cardiotoxicity caused by bupivacaine is ventricular tachycardia, and it is the more potent and longer acting compared to that of the lidocaine. Because it is long acting, the addition of adrenaline does not increase the duration of this particular bupivacaine. And for spinal anesthesia, the solution made is 0.5% solution, and the ECG changes what we see with the bupivacaine is slow idioventricular rhythm with broad QRS complex, and the maximum dosage of the bupivacaine is around 2 mg per kg. Alright, next. Now, ventricular tachycardia caused by bupivacaine, what is the drug of choice? Remember, bretylium. Bretylium, this is the drug of choice for ventricular tachycardia caused by bupivacaine. Caused by bupivacaine. Remember this point. Next. Now we have a congener of this particular bupivacaine. The congener of the bupivacaine, this is nothing but ropivacaine. Right, this is nothing but ropivacaine. What is the advantage of this particular ropivacaine over the bupivacaine is, remember this particular ropivacaine is less cardiotoxic. Right, remember this point, this is less cardiotoxic congener of this particular bupivacaine. Alright, next, let me talk about another drug which is a local anesthetic, which is called a prilocaine, which is the prilocaine. Remember, prilocaine, it will produce a metabolite which is called as otolidine. Right, it will produce a metabolite which is called as otolidine. This particular otolidine, it is an oxidizing agent. This otolidine, this is a oxidizing agent. Alright, next. The other point is, this particular otolidine can oxidize hemoglobin to methemoglobin. Right, this otolidine can oxidize hemoglobin to methemoglobin. Alright, so this prilocaine is the drug which can cause methemoglobinemia. Right, prilocaine is the drug which can cause methemoglobinemia. Why? Because it can oxidize hemoglobin to the methemoglobin. Is that clear? Now, an important point about the prilocaine is, remember, this is the most suitable local anesthetic for the Bayer's block. I'll tell you what you mean by this particular Bayer's block in the further part of the discussion. Alright, so prilocaine is the drug which is given in case of the Bayer's block. Next, now let me discuss another important local anesthetic which is called as oxytazine. Right, another important local anesthetic which is called oxytazine. This particular oxytazine, this is also called as mucaine. Right, this is also called the mucaine. This particular oxytazine can be used to provide symptomatic relief in gastritis. Right, it is used for symptomatic relief in case of gastritis. It remains unionized in acidic pH of the stomach. That is about the oxytazine. Alright, So after the bupivacaine, we have discussed ropivacaine, which is less cardiotoxic and it is a congener of the bupivacaine. And then we have prilocaine. It will give a metabolite which is called as otolidine, and this particular otolidine is an oxidizing agent. It will oxidize hemoglobin to methemoglobin, and thereby, remember, this prilocaine will cause methemoglobinemia. And remember, this is a very important drug that can be given in Bayer's block. And we have a drug called oxythiazine, which is nothing but mucaine. It is useful for symptomatic relief in patients with gastritis.